Welcome to today's explainer. We're going to take a pretty incredible journey inside the most vital, continuously running machine in existence, the human heart. I mean, think about it for a second. It's the ultimate engine, beating around 100,000 times a day, pumping enough blood to literally fill an entire swimming pool over a year. And it does all that without you ever having to press a start button. But what happens when that remarkable engine needs major repairs? Well, let's dive right in and explore the fascinating, really high-stakes world of open-heart surgery. So, this brings up a genuinely mind-bending question. What exactly happens when a human heart is paused? Imagine driving your car down the highway and you need to rebuild the engine while the car is still moving, and you can't even cut the power to the radio or the headlights. Crazy, right? How do these master medical mechanics safely stop, open, and repair our central biological pump and then perfectly restart it? In this explainer, we're going to demystify this whole awe-inspiring process.
Here's our roadmap for today. First, we'll look inside the human heart, then discuss what happens when the heart needs help. After that, we'll step inside the operating room, explore the surgical fix itself, and finally, look at the road to recovery.
Section 1. Inside the human heart, the ultimate engine.
All right, looking inside the chest cavity, we're basically looking at a highly synchronized mechanical system. First up, we've got the atria and ventricles. These are your muscular, main pumping chambers doing all the heavy lifting. Then we have the valves. You can think of these as super precise one-way doors that snap open and shut, just making sure blood never flows backward. We've also got the major blood vessels, which act as the primary routing pipes, sending oxygenated blood out to your body and bringing the depleted blood back. And finally, the coronary arteries, which serve as the really vital fuel lines.
Let's focus in on those coronary arteries for a second. They form this intricate superhighway of blood vessels. Now you might be thinking, isn't the heart already filled with blood? Well, yeah, but the thick muscle tissue of the heart walls can't just absorb oxygen directly from the chambers. It needs its own dedicated fuel lines to supply oxygen-rich blood right to the working muscle. When these lines are running perfectly, the engine purrs. But when they don't, well, that's when we run into trouble.
Which brings us to Section 2, when the heart needs help, engine breakdown. Despite being an absolute evolutionary marvel, this highly sophisticated biological machine can sometimes malfunction and require specialized intervention. The three primary reasons surgeons need to step in are severe coronary artery disease, valve disorders, and congenital heart defects. So, coronary artery disease is kind of like sludge building up in those fuel lines we just talked about. Valve disorders happen when those one-way doors get stiff or leaky. They lose their precise seal. And congenital heart defects? Those are structural issues present from birth. Actually, you can think of it like a factory defect in the engine's original blueprint. To put it in perspective, a perfectly healthy heart relies on unobstructed coronary arteries and perfectly sealed valves to ensure smooth, powerful blood flow. But when disease sets in, it's a different story. Blocked arteries actively restrict fuel, practically starving the muscle, while failing valves create all this chaotic turbulence, disrupting that crucial one-way flow. The heart is suddenly forced to work twice as hard just to maintain basic function. And when the machine is struggling that much, surgery isn't just an option anymore. It's an absolute necessity.
Section 3. Inside the operating room, preparing for the fix.
You know, the modern operating room is nothing short of breathtaking. It really isn't a place of fear. It's more like a sanctuary of precision. This is where the master mechanics assemble. We're talking about a highly coordinated team, expert surgeons, specialized nurses, anesthesiologists, all surrounded by this incredibly advanced monitoring equipment. They work in total sterile harmony. Literally every single instrument, every glowing monitor, and every team member has a specific, meticulously rehearsed role to play long before the first incision is ever made.
Moving on to Section 4. The surgical fix, repairing the machine.
The monumental task of open-heart surgery generally unfolds in three distinct, highly controlled stages. Step 1 is safely accessing the chest cavity to expose the heart. Step 2, and this is perhaps the most incredible part of the whole shebang, is engaging the heart-lung machine. And then Step 3 is performing the actual, precise surgical repair on the quiet, still heart.
So that heart-lung machine I just mentioned, it is exactly what makes all of this possible. It acts as a temporary biological bypass system. Since surgeons obviously can't easily stitch a wildly beating heart, they use this miraculous piece of technology to safely pause it. Blood is carefully routed out of the patient's body and right into the machine. The machine then infuses it with oxygen so effectively that it completely takes over for your heart and lungs. It literally keeps the entire body alive and well while the actual heart is stopped and being worked on. Mind-blowing, right? Once the heart is safely paused, those master mechanics get straight to work. And what exactly are they doing in there? Well, they might be bypassing blocked coronary arteries. To do this, they'll actually take a healthy blood vessel from another part of the body, like the leg or the chest, and graft it in, creating a literal detour right around the clogged fuel line. Or they might be repairing damaged heart valves, carefully reshaping the tissue so those one-way doors snap shut perfectly again. And if a valve is just severely compromised, they'll completely replace it with a mechanical or biological substitute. Now, to really appreciate the magnitude of this fix, let's picture the before state. Picture the engine struggling. You have blocked arteries practically starving the heart muscle of oxygen, which leads to chest pain and extreme fatigue. Or you've got damaged valves failing to maintain pressure, causing blood to leak backward. The entire system is basically teetering on the brink of catastrophic failure. The tension in the tissue is palpable. But then, the after. Once the grafts are sewn in or the new valves are seated, the surgeons carefully wean the patient off the machine. The heart is gently shocked back into its natural rhythm, and suddenly you have unobstructed, beautifully restored normal blood flow powerfully coursing through the engine once again. The starving muscle is instantly flush with rich, oxygenated blood. The new valves snap shut with a hugely satisfying airtight seal. Just like that, the machine is back online.
Section 5. The road to recovery. The engine rebooted.
The timeline for recovery is definitely a gradual, deliberate process. In the first few days, it's all about immediate postoperative recovery in the intensive care unit. This involves really close monitoring of that newly rebooted engine and allowing the initial healing to begin. Moving into the weeks that follow, the patient transitions into dedicated cardiac rehabilitation. This is the physical rebuilding phase, slowly increasing activity levels to train the healing heart. And looking out over the months and years, long-term success really relies on maintaining healthy lifestyle habits like nutritious diet and regular exercise, alongside regular follow-up care. The mechanics fix the engine, sure, but the owner has to maintain it.
And that perfectly tees up our final thought for this explainer. You've just seen the awe-inspiring scientific journey of how we can pause, repair, and restart the human heart. It is a genuine marvel of modern medicine. But the best intervention is always, always prevention. Now that you know exactly how delicate and vital this engine is, how will you protect yours today? Think about the fuel you're putting into it and the daily maintenance you're giving it. Thank you so much for joining me on this incredible look inside the open heart. Keep learning, stay curious, and hey, take care of that engine.